Here we go. All right, great. All right, so welcome everyone. We are here together this late afternoon, early evening, to talk about sexual health education in Alabama schools. So this is our preview module of the Sex Education Professional Learning Series, or SUPPLES. So this is just like the very beginning of what will be a longer series that I'm going to talk some more about here. Get going. All right. So welcome. For those who don't know me, my name is Christina Clark O'Karmas. I use she, her pronouns, and I'm the Executive Director of the Alabama Campaign for Adolescent Sexual Health. I have been with the Alabama Campaign for almost 10 years, which is hard to believe. I started right out of graduate school, and I've been the Executive Director for about 2 years. So over the course of the next 45 minutes to an hour, we're going to talk about the SEPLS and sex education in Alabama, and I want you to leave with 4 key takeaways. So first, I'm going to tell you about the foundation for SEPLS. So how it came to be and why we think it's going to be important for educators in Alabama. We're also going to give a quick overview of how you can access the SEPLS going forward and how educators can get CEUs. If you are not an educator and you'd like CEUs, please reach out to me. I will do my best to look into that for you. There may be a fee that applies. However, for educators, it is free. And the fee would only apply to the CEUs, not to the course itself. So next, we're going to dive into laws and policies that impact sex education in Alabama. And so those include the Alabama Sex Education Law, the HIV/AIDS resolution, and the Alabama State Department of Education Health Courses Study. And then finally, we're going to tell you about some of the benefits of providing sexual health education to young people, especially in Alabama. And we're going to invite you to learn how you can do that through the rest of the SEPLS series. Before we get into all of that, I want to take a few moments to tell you about the Alabama Campaign for Adolescent Sexual Health. We started 22 years ago as the Alabama Campaign to Prevent Teen Pregnancy. We were started by a group of citizens who were concerned about the high rates of teen pregnancy in Alabama. By the time Alabama's teen pregnancy rate was Alabama's teen pregnancy rate was one of the highest in the country. And over the years, the teen pregnancy rate has declined significantly, thanks in part to policies like the Affordable Care Act and funding for evidence-based programs. And as that decline happened, there's also been a shift nationally to more trauma-informed and shame-free approaches to sexual health education. So in 2018, the board of the Alabama Campaign voted to change our name to the Alabama Campaign for Adolescent Sexual Health. And so not only was that a reflection of those trauma-informed and shame-free approaches, but it was also a reflection of the broader work that we do at the Alabama Campaign. We're not only focused on teen pregnancy prevention anymore, we're also concerned with other factors that work in sexual health. So things like bodily autonomy, consent, disease prevention, healthy relationships, and so much more. There's so much that goes into sexual health. So the Alabama Campaign works in 4 areas. We provide training like this one to youth-serving professionals like you. Sometimes these trainings are teaching key concepts and knowledge, which is what we'll do through this series. And sometimes we're training on specific evidence-informed curriculum. We provide resources on adolescent sexual health to the public through our website, social media, speaking engagements, health fairs, and others. We are advocates for sexual health in our communities. Every year we take part in advocacy activities at the federal, state, and local levels. So for example, we might advocate to remove the homophobic language from the sex education law. We may ask our legislators to support evidence-informed sex education. Writing model sex education policy that may be used at the local level. And we even draft position statements on current issues. These are all examples of the advocacy that we do at the Alabama campaign. And we also work in partnership with several state agencies, community-based organizations, national organizations, and universities. We leverage those partnerships to advance sexual health education and services for young people in Alabama. We actually have some of our partners on today. So Sue Jones from the Focus program is one of our partners, and she was a great help in getting SUPPLES going. Valerie Lockett from the Alabama Department of Public Health is also on. And if you're on and you're one of our partners, I just didn't see you, so I'm not trying to slight anyone. I just wanted to say hi to both of those partners. If you want to learn more about the Alabama campaign, I invite you to check out our website. We'd also love for you to sign up for our monthly e-newsletter. So this newsletter sends an email once a month and sends the latest information on training and resources as well as relevant news. So it's a great resource. So it probably seems like, based on everything I just said, that the Sex Education Professional Learning Series is an obvious fit for the Alabama campaign, and you're totally correct. But it has taken us a lot to get here. So we've known for many years that Alabama educators do not have the training and resources that they need to provide sex education to their students. The 2018 CDC School Health Profile Survey, which surveys lead health educators, found that in the previous 2 years, over 75% of teachers did not receive professional development on teaching students of different sexual orientations or gender identities, and 80.7% of teachers did not receive professional development on building student skills in HIV, other STDs, and pregnancy prevention. So we've also had interest in training from teachers in the Alabama State Department of Education, but unfortunately there hasn't been funding available until now. So in August 2020, we were awarded a grant from the Central Alabama Community Foundation to provide training to educators that will give them the knowledge and skills to provide sexual health education in their classrooms. Our original proposal was to provide this training in person to educators in the Central Alabama region. But as you probably know, COVID derailed that, and it required us to move to an online platform. But what's great about that is that we're able to have a much wider reach now. So for instance, I saw someone is here from Mobile, and Mobile would not have been one of the counties that we would have been able to reach through our original proposal. So in some ways, moving online was a great benefit. So our Sex Education Professional Learning Series is based on the Professional Learning Standards for Sex Education, or PLSSE. The PLSSE was released in 2018 by the Sex Education Collaborative, and they call themselves the SEC, which is kind of funny for us Southerners. And they're a collaboration of 20 national, regional, and state-based organizations with extensive experience training educators to deliver school-based sex education. The PLSSE was created to provide guidance to school administrators and classroom educators about the content, skills, and professional disposition needed to implement sex education effectively. The SEC said, teaching young people sex education is different than teaching about other school-based topics. Educators must navigate the diversity of views and lived experiences of their students while being careful not to perpetuate fear and shame. And more often than not, they must do so with limited time and resources. The PLSSE has 16 topics to be covered. So we've worked really hard to pare that down to just the bare bones of what an educator needs to know to incorporate sexual health content into their classes. So let's talk about some logistics. After this initial preview module, the SUPPLES will have 6 modules to complete. These 6 modules will be available online to work at your own pace. They'll be rolled out every 2 weeks through April, and each module is worth 1 educator CEU. If folks are interested in other CEUs, please let me know. We'll work to get that worked out. It may not be possible in all situations, but we'll do our best. And there may be some fees that apply to getting those CEUs, but we will, of course, let you know that as well. So you'll access the SEPL modules, which are free, using a platform called Teachable. So each module will be a combination of reading, videos, and worksheets, and it should take you no longer than an hour to an hour and a half for each module. Again, you can work at your own pace, so we hope this will be extremely accessible to all educators and others who work with young people. I'm going to take you a moment, I'm going to take a moment to show you the Teachable platform so that it'll look maybe a little familiar when you get in there. So this is what it will look like. There may be some branding, some of our branding that says Alabama Campaign, but it'll basically look like this. You'll see a module. So this is our first module, which is professional disposition. And under the module, you'll see several lessons. So as you click, and I'm not going to click on this only because there's no content in here yet, but as you click start, it'll take you to the content for what is of value. And then as you complete each lesson, you'll see your progress here on the left side. You'll see your progress. And so then when you've completed each module, you'll receive a certificate for your educator CEU for that module. So you won't receive all your CEUs at the end at once, unless you let me know that that's how you'd like to do it. Instead, you'll receive each CEU certificate at the end of each module. Okay, let me get back to our slideshow. All right, so what are we going to work on in these next 6 modules? In module 1, we're going to discuss professional disposition, which I just gave you a little sneak peek of that. So this module will give you the opportunity to examine your values around sexuality and learn how they can impact your work with young people. In this module, we will also talk about self-disclosure. That is what it is and how to minimize its effects. Module 2 will explore best practices in sex education, including how to create an inclusive and affirming learning environment, effective teaching strategies, and responding to challenging questions. Then in modules 3 through 6, we will begin to focus on key content areas, including healthy relationships, consent, interpersonal and sexual violence, LGBTQ+ identities, transgender and gender expansive identities, puberty and adolescent development, sexual and reproductive anatomy and physiology, contraception, pregnancy and reproduction, and HIV and other STIs. So even though we're not doing 16, there's still a lot in there. We anticipate that the following schedule will be used as release dates for modules 1 through 6. We appreciate your patience as we work through any hiccups in getting these up on these dates. So module 1 should be released February 15th, module 2 on March 1st, module 3 on March 15th, module 4 on March 29th, module 5 on April 15th, and module 6 on April 29th. So you'll have all the modules available at the end of April, and they'll be available, we hope they'll be available through the whole summer. For the purposes of our grant ends at the beginning of July, and so we will give them those numbers at the beginning of July, and then we hope that it'll just continue to remain available even though we won't be reporting back on the grant for that. So I've covered a lot in the last few minutes. What questions do you have about the foundation for the SEPLS or any of the logistics for the SEPLS? Please put those in the comment box, or there's even a Q&A box, I think. Yeah, there's a Q&A box if you prefer to do that. Go ahead and do that now, and we'll just take a beat and see what questions you might have. Any questions at all about the content? Okay, Valerie would like information on social work CEUs. I can look into that. We have a good relationship with DHR, so that may be a possibility for us to get those. And maybe even for free, hopefully. Do we plan to present these modules at any conferences being held during the summer? So there's no plans for that yet. Certainly if we're invited to do some of that over the summer, I would love that opportunity. We would of course want to make sure that we're not doing any in-person conferences this summer, just to be extra cautious. Unless maybe it's at the end of the summer, maybe by then we'll have things under control or headed in the right direction. But if anyone knows of any opportunities where we could present some of this information, that'd be great. Because each of these can certainly be presented as a module unto themselves, and they also work really well as a series. So anyone has any leads on conferences, just holler at me. Any other questions? So I'm going to move on. If other questions arise, please put them in the question and answer. Oh, and I see somebody has some other question. Okay, in module 3, will you talk about what the difference between relationship and being groomed? Okay, so I think that you are referring, and you can correct me if I'm wrong, I think that you're referring to being groomed as in sexual abuse or sexual violence, relationship violence. So we will be talking about healthy relationships and what constitutes an unhealthy relationship, and so being groomed would be part of that unhealthy relationship conversation. So yes, if I'm understanding your answer correctly, or your question correctly. Okay, if other questions arise, just drop them in the question and answer, and I will answer them as soon as I can. So I'm going to move on to the primary content for us for this afternoon, sex education in Alabama. So there we go. So there are 3 guiding policy documents at the state level for sex education in Alabama. These are important to know for anyone who is planning to teach sex education. So first, we're going to discuss the Alabama sex education law. We often say that this is a permissive law, but that certainly doesn't mean that we think it reflects all of what we'd like to see in a sex education law. So to start, the law is not a mandate. It's an if-then law, which means that if you teach sex education, then you must follow these guidelines. It also states that these are the minimum, which means that you're able to teach above and beyond these guidelines. Several times, the law requires an emphasis on abstinence. Note that an emphasis on abstinence does not mean safer sex practices cannot be taught. At the Alabama campaign, we very much agree that abstinence is a part of a larger conversation about sexual health and about sexual health practices. And we think that it's a great tool for young people to have in their toolbox to use for as long as they would like. Delaying sexual debut is a great choice for many young people. However, in regards to the sex education law, the law does state that if sex education is taught, then you must teach about the reliability and the unreliability afforded by various forms of contraception, while also emphasizing the increase in protection against pregnancy, HIV, and STDs afforded by various measures of contraception. So if you teach sex education in Alabama, you have to emphasize abstinence, but you also have to talk about contraception. So this is a big deal because a lot of folks come to me and come to us at the Alabama campaign, and they say that we have an abstinence law, or they refer to the sex education law as the abstinence law. And we do not have an abstinence only law. That is untrue. The law states that course materials should be age appropriate. What's age appropriate for someone in elementary school isn't age appropriate for someone in high school, and vice versa. While it wouldn't be age appropriate to talk to kindergartners about condoms, it is also not age appropriate to talk about abstinence or talk about only abstinence to a group of high schoolers. So we need to have a more comprehensive conversation with them. There's also guidance in the law to teach about sexual abuse, reporting sexual abuse, and legal options available for victims. The law does state that abstinence from sexual activity outside of lawful marriage is the expected social standard. However, our position at the Alabama campaign is that this language can be shaming for those who have had sex, and it is also not factual. For some, abstinence may be expected, and for others, it may not be expected. So this is a value statement, which is what we'll talk about in our first module. The most difficult and damaging part of the sex education law is the homophobic language that it contains. Not only is it harmful to LGBTQ people, but it's also false information. Again, they're trying to speak to a social standard that cannot be proven, and they're referencing an anti-sodomy law that was struck down by the Supreme Court in 2003. This makes our law one of only 5 in the country that discriminates against LGBTQ people. And so those other states are Mississippi, Louisiana, Oklahoma, and Texas. Next, we're going to talk about the HIV/AIDS education resolution. This requires that schools teach about AIDS and HIV as part of their health education curriculum beginning in the 5th grade. However, this resolution does not have any funding attached to it. Teachers are not provided any professional development specific to HIV and AIDS unless they seek it out for themselves. And there's no tracking mechanism so that we can know what each school is teaching. So for some schools, they'll bring in a guest speaker at an assembly. At some schools, they'll have a whole unit in a health education class. So it varies greatly. Impressively, I always sort of chuckle at this, some schools manage to talk about HIV without even discussing sex. So they may mention that HIV can be passed through sexual behaviors without telling what those sexual behaviors are, and they probably don't talk about how condoms can prevent HIV. The final guiding document on sexual health education in the state of Alabama is the Health Course of Study. The Alabama State Department of Education released the newest health course of study in 2019, and this document is meant to be updated every 2 years. The goal of the health course of study, the goal of health education in Alabama, as stated in the health course of study, is to help students develop optimal health for life. I point this out because the health course of study mirrors the law with a strong emphasis on abstinence. If the goal is optimal health for life, we know that most people will have sex at some point in their life, then we should present comprehensive information about sexual health so that young people will know how to take care of their sexual health at any point in their life. The health course of study also promotes health literacy and is meant to build a foundation on which young people are able to use health information and services in ways that enhance their health. The health course of study outlines the minimum required content that students in grades K through 12 are expected to learn in a health education course. Once again, if abstinence is the minimum, then the sky is the limit. But many teachers do not feel comfortable or competent to go above the minimum. We know anecdotally from teachers that they want more guidance on what should be included in sexual health education classes, and that they're afraid they might overstep or break the law. The health course of study does not dictate curriculum or teaching methods. In 2019, a committee was assembled to select a health curriculum as an option for schools. And at the Alabama campaign, we had a chance to review that curriculum. On the plus side, it contained medically accurate language, it talked about condoms, and information on healthy relationships. Unfortunately, it did fail to mention how to prevent pregnancy, and in fact, it did not actually explain how pregnancy occurs. It did, however, talk about the detrimental impact of pregnancy on young people. which to us was sort of weird because they didn't tell people how pregnancy occurred or how to prevent it, but there was information about how it could ruin their lives. So that was a bit of a disconnect for us. Again, the Health Course of Study states that content standards are minimum, and you're going to hear me talk about minimum a lot. And they're not exhaustive. That means that as long as the minimum is covered, you can go above and beyond. The problem remains that teachers don't know what that looks like, and they lack the knowledge and skills to provide additional information. And that is why we created the Sex Education Professional Learning Series. We're here to help. We want to give you the knowledge and skills that you need to incorporate sex education into your health classes and the confidence to do it. All right, so the 2019 Health Course of Study also added this piece of information that was not included in previous health courses of study. It is highly recommended that local school systems develop and adopt a policy regarding the instruction of sex education content for their schools in accordance with laws, regulations, and resolutions in age and content appropriate contexts. So, for us, we see this as an opportunity for advocacy, for model policy, and a way to get quality sex education in public schools. When you have local control like this, sex education can look like this. Don't get sex, you'll get pregnant and die. Or it can look like this, where you have someone putting a condom on a banana. But mostly you're gonna get this, which is just a group of teenagers who have a million questions and nowhere to turn because the school doesn't have the capacity to take on sex education. And that's the problem. Since there's no mandate to teach sex education and no set curriculum or standards outside the Health Course of Study, we don't know what, if anything, is being taught in public schools. But we do know that young people have questions. So you might be asking yourself, if sex education isn't mandated, then why should you do it at all? So I'll be the first one to tell you, I understand that educators are overworked and underpaid, especially in a global pandemic. Y'all have had to deal with a lot in this last year. I also believe that you probably became an educator because you want to make a difference in the lives of young people. And comprehensive sex education is extremely beneficial to young people. For the last several years, with efforts behind evidence-based sexual health programs, we've seen a decline in teen pregnancy rates. So this is the last 10 years. You can see a dramatic decline in Alabama's teen pregnancy rates. We've also seen dramatic declines in teen birth rates in Alabama. We've seen sexual risk behaviors decline while protective behaviors have increased. So the Youth Risk Behavior Survey, which is what I'm about to cover, is conducted every other year and is a collaborative effort between the CDC and state departments of education. In 2019, we saw sexual risk behaviors mostly decline. Less students reported having ever had sex, which is especially interesting since most people believe that young people are now having sex more than ever, which is just not true. The percent of young people who had sex before the age of 13 declined. The percent of students who had sexual intercourse with 4 or more people in their life declined. And the percent of students who were sexually active in the last 3 months declined. Fortunately, the percent of students who used a condom at last intercourse increased, which was untrue in the last several years. And the percent of students who used birth control, various methods of birth control, also increased. Unfortunately, what's not declining is our STI and HIV rates among young people. As you can see, ages 15 to 19 account for only 6.5% of the total population in Alabama, but they have a disproportionately high rate of chlamydia and gonorrhea in particular. Montgomery, Alabama has the 5th highest STI rate in the country, and Birmingham has the 20th highest rate in the country. So we have 2 cities in the top 20 of the highest STI rates in the whole United States. And while young people ages 13 to 19 do not have a particularly high rate of HIV infections, young adults in the age range of 20 to 29 certainly do. It's not hard to imagine that young adults in this age range did not receive adequate sexual health education to help protect them against HIV. Further, the lack of inclusive sexual health education means that lesbian, gay, and bisexual students have higher incidence of sexual behaviors and risk-taking behaviors than their heterosexual peers. So this is YRBS data, national YRBS data, not Alabama specific, from 2017. And it shows that more lesbian, gay, and bisexual high schoolers had sex than their heterosexual peers. More lesbian, gay, and bisexual students did not use a condom. More lesbian, gay, and bisexual students did not use hormonal birth control than their heterosexual peers. So that's sort of the bad news. So the good news, the first good news is that our sexual outcomes are improving. Then the bad news is that our STI rates and our HIV rates are not great. And in particular, we don't have good sex education that's inclusive for LGBTQ students, and so they're falling behind. But another piece of good news is that sex education has really strong support in Alabama. So in a 2017 University of South Alabama survey of parents of school-aged children, 82.7% said they believe that children should be taught sex education in school. When asked about specific topics, 97.5% said that they believe it is somewhat or very important that their children learn to talk to a partner about birth control and STIs. And 98.1% believe it is somewhat or very important that their children, learn about the use of condoms. So that's really high numbers, as close to 100% as you're ever going to see. The vast majority of parents of school-age children believe that their young people should be learning about more than abstinence in schools. In that same year, 2017, we surveyed the Alabama Children's Policy Councils, and we found that 82.5% said that sexual health education should include more than abstinence because these council members believe that young people are engaging in sexual risk-taking behavior and they need more comprehensive information. So in summary, Alabama policies are a lot more permissive of comprehensive sex education than one might think. Remember, we do not have abstinence-only policies. The law explicitly states that if you teach sex education, then you have to talk about contraception. Young people will continue to engage in sexual behaviors as they have always done. Fortunately, the outcomes of some of these behaviors are improving thanks to better education. It's our job to give medically accurate and age-appropriate knowledge and skills so that young people can protect their health. There is strong support for sex education in Alabama. We often find that the fear of controversy is greater than the controversy itself. Just because there are one or two loud parents in opposition doesn't make them the majority, it just makes them the loudest. And finally, the SUPPLES was created so that you, the educator, can feel confident in your ability to provide sexual health content in your classroom. Talking about sexuality can be scary, it can be taboo, but we are here to help. We really hope that you'll join us for the rest of this learning series to talk about sexuality and to learn best practices for use with your students. So that's actually all I have for today. I left quite a bit of room for questions. I also just moved through it kind of quickly. So I'd love to know any questions that you have about anything that we've talked about today. The logistics and the content of the SEPLS, anything we talked about related to the law, the health course of study, the HIV/AIDS resolution, any of the survey data that I referenced. This entire video webinar will be available on our website in a few days, so you can go back and reference it. I'm also planning to send some documents to those who attended today. I'll send a copy of the sex education law. I'm sure most of you have a copy of the health course of study, but I'll send that as well. I have some other things that I plan on sending. So those documents will be available to you. Any questions at all about anything? All right. The weird thing about webinars is I don't know if I can't see people's faces at all, so I don't know if there's like a question on the tip of someone's tongue. But you are welcome to email me. My email address is pretty simple, Christina@Alabama Campaign. Okay, someone asked, will you send an email on how to sign up? So yes, everyone that's attended today, everyone that's registered for today, I will send an email with the link for the Teachable modules, and you'll be able to sign up there and you'll get updates every time a new one is released. So yes, you will get an email from me on that information. If you need or would like CU credit for today's little webinar, you just need to make sure you take our electronic evaluation, which will be sent to you tomorrow, and send me a screenshot of the completion page, not your answers, but once you click submit, it'll say thank you for submitting. So send me a screenshot of that page, and I will make sure you get a certificate for today's webinar. But for the remaining ones, you won't have to do all that. It'll just be all through Teachable. This is just how we had to do it today because we're in a live format. Thank you, Sue, for coming. I hope it was helpful information for everyone. If you have any questions anytime in the next few days, just give me an email and I'll do my best to answer. And be looking for an email from me that has some documents that I referenced today, as well as information on how to sign up for the SEPLS. And I hope to see you there. Let anyone know that you think might be interested in this learning series. I'll just leave this open for another minute in case anyone wants to ask a question. But we are finished. Thank you, Lauren. Thanks everyone for attending.